On a recent trip to Atlanta, we caught up with Dr. Lucky Jain, a professor of pediatrics at the Emory University School of Medicine. Dr. Jain specializes in neonatology. His research interests include respiratory disorders in the newborn.
The main focus of our research is looking at how the lungs clear fluid. Now, the knowledge gained from such research is relevant to the newborn as it starts to make its transition from fetal living to postnatal, or meaning living after birth, when the lungs start to breathe for the baby. Because prior to that, the mother was breathing for the neonate. Okay? As adults, that information is relevant because here and there we get into situations where our lungs get wet, whether it's because of heart failure or it's because of a pneumonia or an infection. And so knowledge gained from these processes can help us devise therapies to treat lung or excessive accumulation of lung fluid. The research focus is on how the lining cells, those cells that line the lungs, participate in clearing of the fluid. So there's a very extensive process that has now been mapped out. There are some similarities between the newborn and the adult, but there are also distinct differences in the way they address this problem. The newborn is much more capable of clearing fluid than the adult. And it makes sense because when it is born, it has a bulk of fluid, a huge amount of fluid in the lungs that it needs to clear. And so it's almost like Mother Nature is looking after every need that we have, and certainly it comes in very handy after birth. Here we have a situation where the fetus is actively secreting a lot of fluid to distend its lungs, and then it's time to be born, and you have to reverse this process where the secretion needs to stop. But not only that, very rapidly the fluid needs to be absorbed. It's almost like having been submerged in a swimming pool for 9 months, and you come out and suddenly somebody says, now clear your lungs, cough it out, or do whatever and start breathing. A majority of us can't do it, but every single newborn makes an attempt to do that, and most of them are successful. The area of research for us has been, what is this biologic switch that allows fetuses and newborns to make this transition from secretion of fluid to absorption of fluid. One of the key findings in that has been that there are endogenous mediators. In other words, there are chemical and hormonal mediators that somehow signal to the fetus that it is time to be born. And so in the day or two prior to being born or going into spontaneous labor, the fetus has started the process of clearing the fluid. And then during labor and after birth, that process continues. Now this preparation in part is because of secretion of very high level of steroids and catecholamines, which are epinephrine, norepinephrine, hormones that we normally associate with stress and fear and preparation for flight. So the fetus does it in a very coordinated manner, and that allows the lung to switch from its previous mode to a mode where it rapidly absorbs fluid. If you look at the cesarean delivery rate in the US, in 1970 it was 5%. That meant that for 95% of mothers, the fetus knew when it was time to be delivered and had done the preparation for a safe landing. Okay. Now the cesarean section rate is 31%. Okay. There are countries where 1 out of 2 babies are delivered by cesarean section. And so there is much more relevance to our work now than before, because lung fluid clearance problems have started to manifest in a bigger in larger fashion than ever before. And so these babies present, for the most part, with what we call transient tachypnea. It's a problem where the fluid never got cleared completely, and so the lungs struggle with that remaining fluid. And the first response of the body is to start breathing rapidly. This breathing rapidly is called tachypnea. Okay? So as we start breathing rapidly, we try to clear the fluid, but because the baby's breathing rapidly, it can't feed properly because the coordination of sucking, swallowing, and breathing is pretty hard to begin with, even under normal circumstances. The other problem is that when babies breathe rapidly after birth, we get worried. We wonder if it's because of an infection or some other problem. And so when babies get admitted to the ICU, we start doing workups and start antibiotics, and one problem leads to the next. And that's really, in a nutshell, why the work related to lung fluid clearance has become so much more relevant now.